Hi, my lovelies. I am going to invite Dr. Louise to join me. Getting quite good at this now. Dr. Louise. Hello, everybody. Let's see if Louise is asked to join yet. No, so I'll just keep inviting her and see what happens. Oh, my God, that was almost too easy. I don't know what happened there. Normally I spend hours pressing, but oh no, I can't. Yeah, there you go. That's better. How's things?
Lovely to meet you, Davina.
Isn't it so funny when I've never met you before in my life, and here we are doing a live.
I know, it's bizarre.
I mean, this is going to be quite interesting because I am so interested in breath work, but I've never done it before. Yeah. And I have spoken to people who are literally evangelical about how brilliant and helpful it's been for them. And so I'd really like to kind of do literally a starter's guide to breath work. But first of all, let me just push this back if I can with the light. First of all, could you tell us a little bit about yourself and, you know, what do you do, and is your interest just in breath work, or is it in breath work and the menopause, or like tell us everything?
Excellent. So I'm a GP, so I've been a GP for over 20 years. I was very lucky. I managed to get an extra 6 months training in women's health, extending my GP training to have 6 months. So I learned to fit coils and implants. So I've just been there for women because they've just gravitated towards me for that. I've ridden the roller coaster of the HRT. So my GP registrar project was on HRT, did loads of prescribing, and then the study happened and nobody wanted it. So I've ridden that roller coaster. And then along the journey, I became a perimenopausal snorer and felt dreadful. My sleep was dreadful, and had a very profound experience with a patient in a coil fitting where I put her in a really profound parasympathetic relaxed state, which she's given me permission to talk about if you want me to. But essentially all that culminated in me finding out that women's breathing changes as we go through perimenopause and menopause, and it has a tendency to be more inefficient, but we can change that. So my passion is about 24-hour breathing efficiency. So trying to help people, if they recognize they're not breathing efficiently, then helping them to breathe efficiently. And it's what I observe is it helps people sleep, it makes people less breathless with movement, and they have better stress resilience. And unfortunately, in the modern day world, we are tending to gravitate more to not breathing as efficiently as what we used to do a number of years ago. So that's me in a nutshell.
So that's so interesting. So perimenopause, I mean, I absolutely know that I don't breathe as efficiently. I can feel it.
Yeah.
And I've just done a health check, and they did a lung function. You know, you sit on a bicycle and I did very well in that because I exercise quite a lot. But they did say erratic breathing,
Right.
And I was like, oh, I've got erratic breathing. Like, what on earth is that? But I think that it's part of this.
Yeah, it absolutely is. I mean, I think it's perfectly possible to thrive as we go through perimenopause and menopause, but I see it as a jigsaw puzzle. So there's lots of different pieces in that. And, you know, we can talk about those pieces, but there's loads of different pieces. But breathing is a piece in that, and we're not talking about it enough. And it may be relevant for some and it may not be. But if people are not even aware it's a piece in that jigsaw puzzle, you can't even start. So I sort of try and say, like, aware, assess and action. So first of all, thank you for letting me increase awareness about this so that more people know about it. But then offering let's talk about how you could assess yourself. And then if it's relevant for you, right, what action are you going to take to do it? And obviously I became inefficient with my breathing, and I did not think I had a problem. I was running 3 times a week. I did not feel breathless, but I clearly was snoring at night. So clearly my unconscious breathing pattern is inefficient because I'm snoring. And the impact that has on you as a human being and your sleeping partner.
And your partner,
Yeah, absolutely. We don't talk enough about the effect on them. and we can change how we breathe, you know, and we've got some element of control over that. Yeah, but I don't know where you want to go, because
Well,
I could go in all
so
directions.
I mean, I've got so much I want to ask you, so I'm excited about this because you know, literally, you've got somebody that knows nothing, so I want to know it all. But it was interesting when you were giving me a little update on who you are and your qualifications. Firstly, I want to ask you the extra time you did on women's health, and you said I was lucky enough to do that. Was that something that you asked to do?
So essentially at that point, I think there was probably a tiny bit more money in the NHS. So I graduated from Birmingham University in 1998, and they just said there's a pot of money. If any of you want to do an extra 6 months GP registrar training with an interest, you do half-time GP and half-time an interest, apply. And I was, amongst others, I was one of the lucky ones. And I said, can I do women's health? So I did sessions in a sexual health clinic, in the Brook Advisory Centre, which was the contraceptive clinic. I had that time then to learn how to fit coils and implants, because it takes quite a while to learn.
Yes.
And then that was just it was always my passion anyway, but it just meant that I'd done that extra bit of learning, got a bit more confidence about being a GP. And then I've followed women along their journey throughout the period. And then obviously the breathing side of thing, I now see it's, if you think about it, Davina, we breathe, we think just because breathing is generally automatic, we think it's automatically efficient, and it isn't. There's this breathing efficiency. So you can breathe efficiently or really inefficiently or anywhere in between. And the trouble is, if you're not breathing efficiently, you're setting your basic foundation of life on an inefficient foundation. So your body will still, you know, your body wants to stay alive. So, and it so needs breathing that your body, if you're breathing inefficiently, your body will still breathe, but it uses the wrong muscles, it activates the wrong system, it can change your biochemistry in your blood, which can change the amount of bicarbonate you put in your urine. It's profound. It is utterly profound. And if you take somebody, I mean, I was probably somewhere in that spectrum, if you like, but I've worked with individuals who are very, very inefficient, and it's quite hard to change. You know, it's not easy, but when they change, it can be life changing, literally life changing. And there's some symptoms that you develop when you're breathing inefficiently you just wouldn't imagine.
What sort of things?
So I've had people begin to smell again on my course. So they've lost their sense of smell, and because they start to breathe again, which efficiently, which means using the nose to breathe is part of that. I assume it's due to neuroplasticity. So I assume that that individual has re-established nasal breathing. They're now putting signals down that olfactory nerve, so the nerve that connects the nose to the brain. And on one virtual group course I did, I had 3 individuals who could smell again, and one had been told by ear, nose and throat that, I can't remember how many years, it was over 10 years she'd not smelt for, and she was told, you're never going to smell again. And I can't believe it, I can smell the bolognese now cooking. And it's because I presume that nerve pathway had got weaker because you're not sending the correct signal down it. And then obviously you re-establish that. Passing urine at night, I did not believe that sleep, improving your breathing at night would stop you getting up to pass urine. I genuinely thought that was going to be rubbish, and I do not pass urine at night now, unless I've drunk something really out of normal. But literally, I do not get up to pass urine, and that is a consistent thing that we find.
That's so interesting. Would it make sense then that through inefficient breathing, we are waking ourselves up, which then you're aware that you might half need to do a wee, so you think, oh, I'll get up and do one. Because I usually find myself waking up going, oh, I think I need to do a wee, but it might be that I'm waking myself up.
Yeah. So there's that, if you're in a bit of a light sleep, then it's, oh, shall I go to the toilet or shall I not? But one of the symptoms of sleep disordered breathing, so I suppose I should define what that is. So sleep disordered breathing is a spectrum again. So at one end, the sort of more severe end, you've got the obstructive sleep apnea, where people have gaps in breathing whilst asleep. You've got heavy snoring in the middle, so I was there. And then at the other end, you've got an increased resistance to the air coming in and out. And I would like to put having your mouth open at that end, actually, whilst asleep. We are not designed to have the mouth open at night whilst asleep. We should be nasal breathing. But that's my amendment to it. And that, obviously, I'm just a jobbing GP. I'm not some researcher. But one of the symptoms of sleep disorder breathing is passing urine at night. Is basically not we should concentrate our urine at night, so we don't need to pass urine. And I did a post on Instagram. It's not quite known why, and there's different thought processes why that happens, and it's a bit complicated, so probably perhaps we don't go into it, but it's definitely definitely a thing. But I think people really need to understand with sleep when we so I think if you don't mind me just explaining this, because I think this concept
say whatever you want, because I am fascinated. Everybody that's watching is saying, wow, this is so interesting. So please.
Is that okay? Tell me if I'm going on too much, then it's okay.
This is fantastic.
So I think the body is truly amazing. All our unconscious processes are driven by our autonomic nervous system. Okay, so me and you are sat here. We are not thinking about our breathing, our blood pressure, our pulse, our bowel, our bladder, our sexual function, our pupil size, our saliva, our digestive juices. All that is happening in the background without us any conscious control. And it's amazing that happens, isn't it? I mean, you know, it's doing all these fine adjustments to it. And that system's been designed so that if it goes more, there's two arms of that. So a lot of people have heard of the fight-flight response. Yeah. So the fight-flight response, that autonomic nervous system is divided into two. One is the fight-flight system. So we call that the sympathetic response. And that system is actually wonderful. We shouldn't give it a bad rap, because what it's doing is when that's driven more, that is your body feels a threat. Your body is going to prime all those processes to survive the next few seconds, the next few minutes, because it feels unsafe. It goes into defense mode. It wants to protect itself. It feels a threat. And when we're in that state, how do we breathe? You know, when I had a dog come up to me when I was running, I thought I was going to be attacked. Automatically, I'm breathing like this. Yeah. So I breathe like this. My part of my brain, the amygdala, is involved in fear. It's spying on our breathing center. So it sees me change my breathing pattern to open mouth, upper chest, big breaths, holding my breath, particularly on the inhale. And then it's, oh, she's in trouble. Right. Put all those processes into defense mode. But there's an opposite system. So the opposite system is the parasympathetic response, or we can call it the rest and digest, feed and breathe, relaxation response. And we breathe the opposite in that. The mouth is closed, it's quiet, it's slow, it's using the diaphragm. And when we breathe like that, then our body thinks she's safe. Now we can go into repair and recover mode. Now we can prioritize those processes which are to do with surviving weeks, months, years. So when we're more parasympathetically driven, we can, libido's there. We want to reproduce with someone. We want to enjoy, digest food. We want to relax. So when we're asleep, we need that parasympathetic response to be turned on so we feel safe, and then all those repair processes can happen. But that means then our breathing needs to be slow, gentle, quiet, mouth closed.
Wow. I mean, I'm just saying I'm not going to keep you here forever and a day, but I feel like I could. There are so many things I want to ask you from that. The first thing being, obviously one of the first non-physical symptoms that so many of us get in perimenopause is anxiety.
Yeah.
And it is that the other, not parasympathetic, the other one that's triggered where you're like, God, like, I don't know what to do. So there could be a way that you could, through thinking about it and breathing, you could try and effectively calm yourself down.
So essentially, there's a couple of things with that. One thing is, as soon as we involve, the mouth has literally no role in breathing apart from making it inefficient. So it has no role in it apart from making it inefficient. As soon as we switch from from nose to mouth, we're losing, I think it's 42% more water. We're breathing an extra 800 millilitres a minute. That was based on a small study. Yeah, so we're over breathing. Okay, and we are then bringing cold, dry, unpressurized, unfiltered air into our lungs. So when I first heard that, I thought, I've been a doctor for so long, I had no idea that all my asthmatic patients, all those with hay fever, those that keep getting chest infections, not once had I asked them, are you using your nose to breathe, to at least warm that air? Because if you bring in cold, dry air into your lungs, it triggers cough and wheeze. And then any virus, muck or whatever will just go into your lungs. So if we're doing a lot of mouth breathing, so whether that's when you're asleep or moving or at rest, you're over breathing. And the trouble with that is it makes you sensitive to the buildup of carbon dioxide. So with anxiety, obviously some of it might be one way is to train your body to breathe more slowly, to breathe more nasally. But then the other thing, and this is from my clinical experience, I haven't found this written in a paper, but this is my experience as working as a breathing practitioner and a GP. I think women become more sensitive to the buildup of carbon dioxide as they go through the menopause.
And what does that make? How does that affect you?
So if me and you were stood at the bottom of a hill and I said to you, right, we're going to march up that hill together, just doing nasal breathing, and you're not allowed to open, we're not allowed to open our mouth at all.
I feel like that would freak me out.
Yes. So how do you feel? If I said to you, do that, what would you feel?
Panicky.
Yeah. So what happens then is you get air hunger, you get a feeling of suffocation, and that is all I've asked you to do is keep your mouth closed, so your mouth is bigger than your two nostrils, so you're not breathing your carbon dioxide out, which is your waste product, as quickly. So it's building up. We're marching up that hill, so you're generating more carbon dioxide, and we've got a tolerance level. So in our breathing center at the back of our brain, we've got chemoreceptors which have a personal tolerance to carbon dioxide. So when it hits your tolerance, you feel air hunger, you feel suffocated. So my question to those who've got anxiety is it that you're anxious, or is it that you're now feeling air hunger because you have reached your tolerance to carbon dioxide? And we can train ourselves to be to be more tolerant to carbon dioxide. And then the wonderful thing with that is carbon dioxide actually releases more oxygen to the body, so you can do more exercise without feeling breathless. Yeah. But also you can do more exercise without getting that air hunger. It comes on later. But actually carbon dioxide is, you won't believe that because obviously you just described how you feel, but carbon dioxide is a narcotic gas. It's actually calming for the central nervous system, so it's calming for the brain and spinal cord. So once you are less reactive to carbon dioxide, once you understand it and can work with it and become more tolerant to it, it actually feels quite calming. So there's the whole aspect of that people can, and carbon dioxide tolerance is probably the most difficult thing to research, and probably one of the more difficult things to teach on something like this, because it depends how intolerant somebody is to it.
I'm quite interested when you talked about walking up a hill and keeping your mouth shut, because hello darling, my partner's just got back. Because when I run, I have heard bits and bobs about saying from doing yoga. I do a yoga class on Own Your Goals with a lady called Rasheen, and she does a lot of nasal breathing in, breathe out. But the minute anything becomes a bit strenuous, not even that hard, so I'm not running in a yoga class, I'm just doing difficult bit. I start doing that. If I'm running, I almost always will be breathing through my mouth. Can I run and breathe through my nose without dying?
Yeah. So that it's likely, from what you've described, but that lung test that you've had, and they've noticed you've got erratic breathing when you're doing it, there's some element there that you're probably not breathing as efficiently as you perhaps thought you were. Obviously your job involves a lot of talking, and that was one of the elements, because I talk a lot for my living. We can over breathe when we talk because we're blowing off a lot of carbon dioxide. and we're going through the perimenopause and menopause. So you can train your body. Now, obviously, if we both took our nose off, we've got a nasal cavity behind there. And when we exercise, we're going to be breathing a bigger volume. So obviously, it depends on nasal cavity size as to at what point you can't shift enough air in and out to maintain the level of exercise you want. But you would be gobsmacked. You would be. So I've got a 68-year-old lady who was on my November course, and so she was skipping before the course, but would have to break it up numerous times. Now at the end of the course, or maybe about 2 months after the course, she can skip continuously for 8 minutes just with nasal breathing. And she measured me yesterday, so she's been on the longest walk she's ever been on with nasal breathing. And that's what I love about improving breathing efficiency, because you feel better, you sleep better, you exercise is not so hard, and then you can make other choices that then are going to help that. It's just like an impetus to move forward. So I would say carbon dioxide training your carbon dioxide tolerance, I would say, would be key. I would love to take you on a breathing journey. So if you wanted to have an individual course with me or join one of my group ones, you're absolutely,
I want to.
no charge, just come on. Because honestly, I think you would be
No, I
really,
and I think want to. I mean, I'm invested because I can hear myself in everything that you're saying.
Yeah.
The other thing I thought was quite interesting, I went to see a hypnotist. I was doing a job called Life at the Extreme for ITV, and it was filming in lots of extreme climates. And we did one on the extreme deep, and I was going in one of those very little submarines with a glass front down to 1,000 meters under the sea. And I'm not a claustrophobic person, but I wanted to get hypnotized to double check that I wasn't going to have a panic attack on the way down. And I went to go and see the hypnotist. And he, in the first session, he said, well, I can see you're shallow breathing. And he said, it's probably a safety mechanism that you've kind of done for yourself because you've been through quite a traumatic childhood. That you it's just you never take in quite enough breath. So he hypnotized me to take one breath every now and again, a deeper breath. But I feel like it happened about 10 years ago. I got hypnotized about 10 years ago, and I can feel that I've sort of stopped doing that. I've kind of forgotten about it now. Why do people shallow breathe, and what's it got to do with trauma? Do you know anything about that?
So the diaphragm, we can hold a lot of emotion in our diaphragm. So if you have a shot, you sort of hold yourself, don't you? So it's a bit like that with trauma, isn't it? You hold the diaphragm then just becomes stiff, and you then not breathing with it. You're more likely to breathe with the other upper chest. My other thoughts on this are, as women, we're sort of taught to hold our stomachs in. Yeah. So, and I remember I was told in the playground in primary school by one of the girls in the playground, who's probably heard from one of the older women, oh, Louise, your tummy looks big, hold it in. And I don't know, did I stop breathing with my diaphragm then at that point? And then the other thing is, I don't know if you know, but women's ribs are hung differently on the spine than men.
I didn't know that.
So men's are more likely to be hung horizontally off the spine, and women's are hung like this.
Yes.
So men are more likely then to be more diaphragmatically breathing. Women, we're like this. I assume it's so they can come up, so we can have a pregnancy. But then that would make us more likely to be upper chest breathers. And as soon as you're upper chest breathing, you're more likely to be breathing fast, shallow, but then you're not using your diaphragm to breathe, and you're not then there's three different aspects to breathing. So one is the biochemistry, so this is this carbon dioxide. One is the biomechanics, so this is what you're talking about, the diaphragm, using the correct muscles. We want to be breathing low, so not big but low, using the diaphragm and the correct muscles. And then the other bit is the sort of psychophysiological part, where our body is much better when we're breathing slower. But in my experience, you don't tolerate breathing slowly if you're intolerant to carbon dioxide. And when I've been doing my coil fittings, my lovely patients have allowed me to experiment on them breathing in different ways. And like I said, there was one lady that I put in a profound...
Oh yeah, will you tell me about that?
So she's given me permission, so I just want to make that clear. So she had had a very traumatic birth. And she said, I can't bear the thought of being pregnant. I have to have a Mirena coil because I want to have something that is reliable and I don't really need to think about it. So quickly got her in the clinic that I run every fortnight. And she literally was in a profound fight-flight response. So literally sort of literally shaking. And I brought her, you still want me to do it? Absolutely. She desperately wanted me to fit it. I got her on the couch and it was really obvious that I was not physically going to be able to put this coil in. But she was desperate. So I thought, right, well, I'll just give her 5 minutes of breathing. And I was doing a little bit of a deep dive in it, but not done my breathing practitioner training. And I thought, I'll just give her 5 minutes, I'll do some emails, and then I'll basically arrange to have a coil fitted under a general anaesthetic. And out the corner of my eye, she just melted into the couch. I am not kidding you. I looked at my assistant and we just went, okay, I fitted it. I had to tap her on the shoulder to say, I've finished. So she was still awake, but it was probably like a hypnosis, yeah. So I put her into a profound. Now, I tried that breathing on other patients and I made them feel utterly dreadful. And then, yes.
I was not expecting you to say that.
No. And this is why breathing is so nuanced, because so I got that patient to breathe in and out of her nose quietly, so silently. So I couldn't hear her. She was breathing in for 4 and out for 6. So that's perfect. That person, I suspect, had an efficient breathing pattern before that traumatic birth. And she'd also done some yoga so she could sort of connect and get into herself. So that helped. But then I've tried that on other people, and either they do 2 things. One, they have to breathe at 6 breaths per minute. They have to overbreathe. So they have to they can't do it with the nose. So it's like, and you do that for 10 minutes and you'll feel lightheaded and feel awful. Or if I insisted that they had their mouth closed and breathe silently, I essentially made them feel suffocated. I made them have air hunger because their carbon dioxide tolerance could not cope with it. And I put them into a panic attack.
Oh, wow.
Well, not quite,
no,
because I could see what
but they get anxious, or it has the opposite effect.
Completely. So it's so important, and I genuinely think the carbon dioxide is such a big part of it, because as soon as you become more tolerant to carbon dioxide, you breathe slower, and when you breathe slower and gentler, you use the diaphragm more anyway, and it comes down into the diaphragm. And then the other thing with sleep, when you start just well, let me tell you, so if you think about it, when you breathe in, and you breathe out, the thing that drives the next breath is your carbon dioxide tolerance. So you've breathed in and you've breathed out, and then it's up, then you've got to breathe in again. So there's some people who are so intolerant to carbon dioxide, they'll breathe in, they won't have quite finished their exhale before the drive to breathe comes in. So this is called air trapping, and this will be common in something like long COVID. So they'll have massive lungs on the x-ray, but that individual feels like they can't breathe. And it's because their drive to take the next breath in is too strong before they've done their full exhale. And that is awful to feel like that.
I wonder awful. How many people feel like that still as a hangover from COVID?
Oh, COVID is terrible for breathing, definitely.
And it made me think, when you were talking about people getting back their sense of smell, I wonder if people that have had COVID, because of their breathing, lose their sense of smell, and then, maybe you could help a lot of people with that. That's amazing.
Yeah, definitely.
You were talking about sleeping at night with your mouth shut. Now, I've seen celebrities with tape over their mouths.
Yeah.
This is not a sexy look.
So when you breathe at night, that is your unconscious breathing pattern. So if your mouth breathing, have noisy breathing, have gaps in breathing, I'm saying it with kindness and good intention, that's your body telling you your breathing is not as efficient as it could be. And I'm saying that from, I'm an ex-perimenopausal mouth snorer. So I'm not being critical or anything like that. But that's your unconscious breathing pattern. Now, to improve that, obviously that's unconscious. So what we have to do is consciously improve how you breathe in the day, gently doing different practices every day. And the neuroscientists say it probably takes 3 months to do something regularly to then make it unconscious. Yeah. So it's not an overnight fix. It's, you've got to do gentle work with it, but you get benefits before then. And then your unconscious breathing pattern becomes efficient and your body remembers that. There's two aspects to correct breathing. So particularly with sleep, we've got a tube here that is collapsible. So we've got to think about that tube. We want that tube to be as open as possible. We need it to be as strong as possible, and it needs to be combined with nasal breathing, because that's how we've been designed to breathe. You know, it's not new, it's not weird. Look at a baby, we've been designed to nasal breathe. So all that needs to happen, yeah. But then we also need to look at how much air we're taking in and out of that airway. If we're over breathing, so I was over breathing, I was shifting far too much air in and out, it's more likely to rattle, which is snoring, or you'll then create too much pressure changes, so then it's more likely to collapse, which is just sleep apnea.
Right.
So I'm not saying everybody who's got sleep apnea and snoring will it will all resolve with improving your breathing efficiency. I've definitely had some individuals that it seems to, although I generally work with people because they don't want a diagnosis of sleep apnea. So I've not had people who've had a sleep study before and after and resolved, but their partner's saying they've not got gaps in breathing anymore and they feel much better. But even if you then say worked on your breathing efficiency for 3 months to get it efficient, you've converted yourself back to nasal breathing again, and say you had to go off, you had a sleep study, you still got diagnosed with obstructive sleep apnea, the first thing they'll ask you is when they're if you're going to have a CPAP machine is, are you breathing with your mouth or nose at night? Because according to the American Workshop report, the most efficient CPAP is nasal CPAP, so it's more effective and better tolerated long term. But if you have a nasal CPAP and you mouth breathe, the air just comes out of your mouth, it doesn't work. So people who use the mouth to breathe have to have the full face mask, which obviously is less well tolerated long term and apparently is less effective. So I would say we want to get you back to nasal breathing as a minimum anyway. So yes, so going back to your question about taping your mouth, yes, part of the answer is getting the mouth closed, and I certainly used a product to get my mouth closed. But by getting the mouth closed, you've not corrected the breathing volume. So if you imagine you've got someone breathing huge amounts of air in and out of their nose, you close their mouth, you've not corrected that. And if that person can't get that air out of there, they'll get mouth puffing, which is that. So they've taped up, and actually that can splint the airway and actually worsen sleep apnea. So I used a product that goes around the mouth. So if I still need to breathe out, it does. I'm able to do that. And now I've corrected my breathing volume, and I do fully tape now, because if I just know too much and I do not want to mouth breathe for a single moment, because I now understand there is some, I could go off on a tangent here about dementia and the brain's waste removal system, but there is a role. How we breathe affects how our brain clears the dementia promoting hormones, and mouth breathing is not good for that. So, but I know my breathing.
I mean, if there is science to prove that, what's interesting is that, this gets worse in perimenopause. 2/3 of Alzheimer's patients are women. It's all it all kind of, when everything starts clicking into place.
Yeah.
The other thing I wanted to ask you is that surely if you start learning to breathe through your mouth at night, is it not that you could start wearing tape for a little bit and then stop? Or would you automatically go back to breathing through your mouth again at night?
So I think you said mouth, but you meant nose, and I think
sorry, nose.
Yeah. So what they say is it probably takes 3 months to create those nerve connections and muscle memory. So I would say I encourage the people that I work with to wear the product around their mouth for basically 3 months. So wear it for 3 months, because then hopefully you've made it an unconscious breathing, an unconscious habit that you are now back to nasal breathing again. And what I say after that is, you know, stop wearing the product and see how you feel. How do you feel on wakening new? Do you feel, you know, is your mouth moist? Do you feel refreshed? It also depends on, you know, position, doesn't it? I have a tendency to like to go on my back, and there's gravity there, isn't there? So, you know, you're more likely to have the mouth open. But yes, of course, you can retrain the body to be a nasal breather again. But if you are someone that then gravitates back to mouth breathing, then you might have to go back to wearing it again. So yes, it's not sexy, but being grumpy, being noisy,
It's not sexy
having no
either.
energy is not sexy either.
God, this has been absolutely fascinating. I'm conscious of time. Can we have another chat
Yes,
another time? I'd really like to kind of get into this a bit more, if that's all right.
absolutely. I would love that. That'd be
And I'll
fantastic.
be in touch, and I'll like repost lots of your stuff online, and hopefully you'll get lots of followers from this, and we can start spreading the message. But that was really, really absolutely brilliant. Thank you so much.
Well, thank you, because this is a piece in the menopausal jigsaw
It
puzzle.
is.
It may not be for everybody, but we need them to know it's a piece, and then they can decide whether it's relevant for them or not.
Can I also say I really love your honesty, you know, when you'll go, oh, I helped some people, but I didn't help others,
Yeah.
you know, with this thing. And so you know, I learned from that. Or anecdotally, this is what I see in my clinic, although I really like the fact that you're just very clear, and you're a very good communicator. So thank you. No, I think that's key, really, isn't it? When you're trying to explain something that's obviously quite complex.
Yeah.
But you've helped me understand. So thank you so much. I can't tell you all the gorgeous messages that we're getting through from everybody just saying thank you so much. So let's stay in
Yeah.
touch.
Yes.
I
Brilliant.
love
No,
this.
thank you
Thank you
very
for
much,
making a
Louise.
difference.
No, and thank you as well. Take care.
Bye.